We could have a sing-along. We could have a sing-along. I will let the audience do that on their own. Hi, everybody. Welcome to the Center for Applied Data Ethics speaker series. My name's Ali. I'm the director of the Center for Applied Data Ethics. I am so pleased to be able to introduce these two speakers to you today. They're a couple of PhD students whose work I've been really excited by for the last little while. And I was so excited when they said that they were interested in coming and giving a talk, and really excited that I was going to be able to pair them together so that they could be in conversation with one another in this speaker series. So I'm going to give them as much time as I can. So without much further ado, I'm going to go ahead and introduce the first speaker, and then I'll jump in the middle and introduce the second speaker. So let's go ahead and get started with Sam Robertson, who's a PhD student at UC Berkeley, advised by Nilüfer Salehi in the Department of Electrical Engineering and Computer Science. Sam, I'll let you take it away.
Yeah, great. Thank you. I will, let's see if I can thumbs up that my slides are showing. Is that all good? All right, great. Yeah, so I'm so happy to be here. Thank you, Ali, for inviting me. Today, I'm going to be talking about some of my work looking into transparency, equity, and community challenges with student assignment algorithms. So before I get started, just wanted to acknowledge my collaborators. Everything that I'll be talking about today has been done in collaboration with Tanya Nguyen, another graduate student, and our advisor, Dr. Nilüfer Salehi. So to give you a little overview of the context here before we get started, in a number of school districts, rather than assigning students automatically to their neighborhood school, students go through a school choice process. So they submit a preference list of schools they'd like to attend, and school districts need to find a way of assigning students to schools. And so for about the past 20 years or so, a growing number of school districts have been implementing matching algorithms from economics as an efficient way to find a good matching between students and the schools they'd like to attend. And before we talk about some of the challenges that have come up with these algorithms, I wanted to zoom out for a second and remember that we're talking about a really complex system, a really complex context with a lot of different stakeholder groups. So we've got not just one student looking for a school, but the whole district of students looking at a number of schools that offer different opportunities and resources. And then on the school district side, you have a board, which is an elected board of a school board who define kind of high-level policy, as well as the district staff who implement that policy, and potentially designers or researchers who are working with them to implement that. And while I come at this from kind of the computer science perspective, the human-computer interaction perspective, thinking about this as an algorithmic system, this is a much broader, this system interacts with much broader questions of educational equity that people have been thinking about and talking about for a very long time. So just wanted to acknowledge that before we kind of narrow in. But in only 15 minutes or so, we're only going to get to talk about a tiny part of this system. And so I decided to focus in on the part of the system that families interact with the most. And so that is student preferences. So in particular, we're going to look at what is the role of student preferences in making these student assignment algorithms do what the district wants them to do, so make them work. And throughout, I'm going to draw on some of the work that I've been doing over the past year, which has involved interviews with parents across San Francisco Unified School District, as well as Oakland Unified School District, which have reasonably similar student assignment systems. So first, let's think about how these systems are modeled on the algorithmic side. So these algorithms have been developed in the field of market design or mechanism design. Mechanism designers see the system as a two-sided market. So on the one side, you have students, they have preferences over schools. And then on the other side, you have schools, and schools have preferences for students. And in the case of an elementary school, they don't have preferences for individual students, but they might have preferences like we want to take siblings of current students first, or we want to take historically underserved students in the district. And then, of course, schools have capacity constraints. So mechanism design tries to come in and think about how can we develop algorithms that will take these two sides' preferences and come up with a matching of students to schools so that everybody is happy and the school's capacity constraints are respected. Now, let's think about what this system looks like from a parent's perspective. So say you're a parent, you have your first child needs to kindergarten. This is your first time going through the enrollment system. What do you see? So you have an empty preference list. You need to fill it in with schools you'd like to attend. And maybe you do a Google search for schools in your area and one of these maps pops up and you see that there's all these options that you could choose from. And you need to try to do a process of information seeking to come up with your preferences. And I've put a little caveat on this slide because this is kind of the way the system designers imagine a parent would go through this. As we're going to see, there are a number of reasons why for some parents this might not look exactly like this. So I have these two slides to kind of highlight the contrast between the model that we're talking about that was used to develop these algorithms and then the reality that families are facing. And when we face these kind of conflicts in values between the designers and the stakeholders, you can imagine that some challenges end up arising. So next I'm going to try and talk about some of these challenges that come up with preferences, but in order to understand why it's challenging, we need to understand what it was supposed to be doing. So I put on this slide some of the goals that student assignment algorithms tend to have. These are taken from San Francisco's policies, but very similar kind of goals hold in many districts, including Oakland. So in San Francisco, the district wanted to make sure that their system was simple to use and transparent to understand. They wanted to promote equitable access to high quality educational opportunities and racially and socioeconomically diverse classrooms. They wanted to make sure that there were quality schools all across the district. And ideally, they'd like to promote a sense of community at schools and continuity, maybe for cohorts between elementary and middle school, or keeping families together, things like that. So these are pretty complex goals, and there's a number of ways that the design of this system can support or conflict with these goals. But in particular around preferences, there are three things that we kind of need to happen in order for the system to meet these goals. The first is that families need to have full information about the available schools so that they can form their preference list. The second is that everybody needs access to an option that meets their needs. So, the system basically assumes that the best case scenario is if everybody was assigned their first choice. But what if one family's first choice isn't necessarily providing the same value to them that another family's first choice is, because of the ways that resources are distributed across the district? And then those two are kind of at the individual level, but at the district level, if the district would like to promote diverse classrooms, for example, choice patterns need to align so that people actually are choosing schools in a way that each school has a diverse applicant pool to accept from. So as I kind of alluded to earlier in the talk, there are some challenges meeting these kind of ingredients. There's time and information costs to finding about schools. There's unequal access to opportunities in terms of maybe transportation constraints or social costs to going to certain schools. And then the design of the system and the way that it asks parents for their individual preferences tends to prioritize self-interest and competition rather than aligning choice patterns with district goals. So really quickly, I wanted to kind of give a little bit more detail on each of these, drawing from some of our interviews. In terms of time and information costs, if you're a first-time parent, you need to understand what schools are available to you, what factors are important to you, how do you find out about the schools that meet these criteria? One parent in San Francisco was doing a lot of school tours to find out about schools and said it was like a full-time job because these tours are in the middle of the day. Another parent in Oakland told us that when she first enrolled her daughter in kindergarten, it was very hard. Single parent, never done this before, never been in a public school. I don't know how everything is run. People just assume that you know what you're doing, and I had not a clue. And this parent actually ended up enrolling in a week-long class of learning how to go through this process to learn kind of how to pick a school and what makes a good school. And kind of reflective of the difficulty of this, there are entire nonprofit organizations that have kind of come up to support families in finding a good school using these systems. The second challenge is unequal access to opportunities. So, the district says that they have an all choice or an open enrollment system, but what does that really mean? When we're talking about school districts that still have massive resource disparities between schools in historically underserved neighborhoods and schools in wealthier neighborhoods. So, one parents we spoke to were facing transportation constraints. They don't have access to a car. They can't drive to the more well-resourced school across the city. They're also facing social costs of going to schools that are higher resource, but have historically served more white students. They don't want their students facing racism in the classroom, and they want to make sure that teachers are going to be able to support their children to succeed. And the third challenge, which is a little bit more difficult because it is this kind of community level challenge, but families are asked for their individual preferences. In fact, one of the big advantages of these algorithms is that they're guaranteed to be strategy proof, meaning that you don't have to manipulate your preferences to try to game the system. You can just give your true preferences, which we have talked about maybe isn't so simple, but your true preferences, and you're guaranteed to get the best possible option for you. But in resource-constrained districts, this can create a lot of stress, people competing for the few opportunities that are available. And under-resourced schools are losing applicants and end up they don't have the resources to respond to attract more applicants. So kind of becomes this negative cycle. So returning back to this model of the student assignment setting from mechanism design. What we've seen is that although this model is really useful for coming up with great algorithms to find good matchings between a two-sided market, and these algorithms have been really helpful over a number of domains, what we're seeing is that from kind of the human-computer interaction perspective, what these methods bring is an understanding of all the complications that go into this little part of the model, where the person has preferences. We kind of assume student has preferences for schools. Actually, that's a really complex process. Preferences end up constructed through this process of talking to people, looking online, finding information. But all of that takes time and resources. So what could we maybe do about this? Before talking about some of the things we think might be interesting, I just want to preface this by saying that I personally have been working on this for around a year, but when we're talking about algorithmic systems, like I said at the beginning, they are just one small part of a much larger system that people have been thinking about for a very long time. So some of the things that we think might be helpful could be providing relevant and accessible information and making sure that's complemented with personalized support to help people actually use that information. The second is maybe reconsidering how families express their needs and constraints. Given that it takes so much work to put these preferences together, maybe there's a better way to be communicating between families in the district. And finally, thinking about all of the human labor that goes into making these systems work the way that we expect them to, and thinking about how the system might have been designed differently or might look different if we acknowledge that work and resourced it. So kind of like I preface this with lots of open questions here. We're continuing to think about this and reconsider them as we gather more data and talk to more people. And of course, just closing to kind of zoom back out and remember that this is one small part of this kind of larger system that we're thinking about. But I think there are really interesting opportunities going forward to think more about how people express their preferences as input to algorithmic systems. All right, thank you so much. I'll turn it over to Devansh now.
Thanks so much. I'm just going to quickly introduce Devansh. Just want to make sure that, there we go. Sorry about that. So Devansh Saxena is a PhD student at the University of Marquette, and he is advised by Shion Guha. And with that, I'll go ahead and let him take it away.
Mhm. All right, can you all see my screen? Cool. Okay, good afternoon, everyone. I'm Devansh Saxena, and today I will be talking to you about algorithms in the US child welfare system. Just a quick slide about me. That's my face on the left. I'm a third-year PhD student at Marquette University in Milwaukee, Wisconsin, and a member of the Social and Ethical Computing Lab. I study collaborative child welfare practice, where decisions are now being made at the intersection of policies, practice, and algorithms. Before COVID, I was spending all my Mondays and Wednesdays at a local child welfare agency to understand how algorithms and policies are impacting decision making. Just a quick shout out to our collaborators, Dr. Pam Wisniewski and Carla Badillo Urquela at the University of Central Florida, with whom we have been doing all of this work, and my advisor, Dr. Shangwa. So to begin with, why should we study algorithms in child welfare to begin with? The child welfare system has been a convenient testing ground for computer scientists and social scientists to study AI's decision-making power and its impact. Most of the attention has been paid to the criminal justice system and how algorithms are being used in criminal sentencing and bail decisions. And because of this, the child welfare system has continued to fly under the radar, even though algorithms are being used for several high-stakes decisions. Moreover, federal initiatives have laid the groundwork for even more algorithmic interventions. A bill was introduced in Congress in 2018 that provides funding for predictive analytics in child welfare. And furthermore, a new data model has been introduced that improves case level decision making at the federal level. So everything considered is just a broader push to employ comprehensive predictive systems in child welfare. And therefore, it becomes critical to investigate the algorithms that are currently being used and also pay special attention to the points of failures. Moreover, it's also critically important to, as Sam said, to unpack and understand these complex socio-political domains. So today I'll talk specifically about Wisconsin and the work that we are doing here. Just a little bit of background. So the state of Wisconsin has been under a federal lawsuit since 1993, brought on by the ACLU for failing to provide adequate child welfare services. A settlement was reached and the state needs to comply with 13 requirements to make the lawsuit go away. They have accomplished 12 requirements, but are still struggling with placement stability. And to achieve that, the state has employed algorithms at several stages of a child welfare case. This figure represents a simplified and linear form of the life of a child welfare case. The green side represents child welfare services. The red side represents the courts. In the red boxes and the red text are the algorithms that are currently being used at different stages of the case. So from the beginning, when an allegation of abuse or neglect is made at the hotline, a risk assessment algorithm helps the frontline worker decide if the call should be screened in for an investigation. If the call is screened in and neglect or abuse is substantiated, the case is referred to the child welfare agency that we work with. Then through the life of the case, the CANS algorithm is used to assess mental health needs of a child, the foster care placement setting that they should be placed in, as well as the compensation that should be offered to foster parents. The 7EI algorithm is used to develop trauma responsive services for families. The legal permanency status algorithm is used to track federal benchmarks such as placement stability, as well as policy and systemic barriers. And finally, there's an algorithm used to assess the risk of being sex trafficked for a foster child. These are being used to make everyday decisions about foster kids, but there are also algorithms that are being used internally and in the back end. For instance, an algorithm is used to assess the risk for re-entry into the system for every case. Before I proceed, I want to offer some context around mandated reporting. We can have an entire series of talks just on mandated reporting, so I'll try my best to summarize some key aspects here. First, 75% of maltreatment cases are cases of neglect. Only 17% involve physical abuse, and only 8% involve sexual abuse. Some indicators of neglect are lack of supervision, inadequate food or clothing, and disorganized family life. Expansion of mandated reporting focus on these indicators, which drove attention away from the more social and structural issues such as poverty, lack of childcare, lack of access to healthcare, and lack of proper housing. The expansion of mandated reporting only led to more investigations into families of color and poor families, with no provisions made to increase the services offered to them. So mandated reporting created the appearance of protecting children, but all it did was drive up investigations with no plan for protection or well-being. And now there are concerns that risk assessment algorithms are creating another layer of obfuscation on top of mandated reporting. This is an example of a radio ad that was being played in the early 2000s. You can still find versions of this being played as well as banners in cities. First, the 19,000 number. So the ad says, last year, over 19,000 Florida children were beaten, burned, neglected, sexually assaulted, tortured, and murdered, mostly by their parents. First, the 19,000 number is a straight up lie. Second, notice how neglect, which is 75% of the outcome, is conveniently tucked in between and inflated with beaten, burned, sexually assaulted, and tortured. This was done to create a moral panic and drive up investigations into families of color. Next, I want to discuss the value conflicts that exist in the child welfare system and between child welfare and the courts. So contrary to popular belief, critical decision-making power does not sit with the child welfare staff. All the critical decisions such as reunification, termination of parental rights, transfer of guardianship are made by the district attorney's office and the judges. Child welfare staff can only make recommendations which can be fully ignored by the DA's office, and they often are. The assistant DAs only interact with families in a court setting, whereas caseworkers interact with them in their everyday lives and know what's going on with the families. Oftentimes, the ADAs can't even pronounce the kids' names right. Then there's the understanding of safety. What does it mean for the child to be safe? Legal perspective focuses on who can be held accountable and preserving the individual rights of a child, even if preserving these rights means breaking up the family. On the other hand, social work's perspective of safety is centered in impending dangers and protective factors in the household. How do we minimize dangers and how do we further develop protective factors? And this basically leads to the underlying ideologies of these two systems. The judicial process is inherently centered in investigation and punishment, whereas social work is centered in protection and service. And this is where a lot of the problems arise. The system is heavily skewed towards the punitive side, where low-income families are being heavily investigated and punished, but are not being helped. Social workers enter this domain to help children and families, but it quickly becomes clear that the system is riddled with systemic barriers that not only inhibit them from helping families, but also force them to make decisions that hurt families. For instance, the 1997 Adoption and Safe Families Act established a 15-month timeline. If parents don't prove to the state in 15 months that they are capable parents, then the state needs to proceed with terminating their parental rights. Every caseworker will tell you that this policy decision is absolutely absurd. So many low-income and now middle-class families are living paycheck to paycheck and are functioning under high stress. And the system's response is to take the kids away and put the parents under even more stress and ask them to get their entire lives together within 15 months. Now, having lived through a pandemic for the past year, we can all begin to understand how much stress is added to our lives if just our daily routines are disrupted. Now, imagine how stressful and traumatic it must be if your child is taken away from you and placed with a complete stranger. Oh, and you can't go visit them. You can only see them during supervised visits. And once again, to reiterate, 75% of the cases are cases of neglect, which is lack of supervision, meaning the family can't afford daycare, or lack of adequate clothing, and lack of, what was the last one? The disorganized family life. How subjective is that? Who scores that, and how much of their own bias goes into scoring that? But all of this is also not to say that caseworkers have no agency. They still exercise discretion in everyday decisions, find services for children and families, and act as mediators between parents, the DA's office, and children's court. And that, sorry, and the children's court. And that street level discretionary work is where our research lies. How do caseworkers make decisions that are mediated by policies, social work practice, and now algorithms? Now, all these algorithms are case studies in and of themselves, but for the sake of this presentation, I will only focus on CANs and 7EI. One important thing to remember here is that all these algorithms are continually collecting data about all cases, and then the inferences drawn are informing decisions about future cases. So yeah, let's talk about these two algorithms. CANS stands for Child and Adolescent Needs and Strengths. It is mandated by the state, and it contradicts theory-driven practice centered in trauma-informed care. It also paints an isolated view of the child without an understanding of traumatic triggers or their ecosystem. 7 Essential Ingredients, on the other hand, is locally developed at the agency and as a pushback against CANs, and is developed using the practice of trauma-informed care. So let's talk a little more about CANs. It is used to assess the mental health needs of foster children and make consecutive decisions based off of that. It takes in the following inputs: a child's risk behaviors, a child's needs, and finally their strengths. And based off of these inputs, it assesses a child's level of mental health needs. It's kind of sort of a Likert scale: low, medium, high, moderate, needs immediate attention. And then based on the mental health needs, it recommends services such as individual therapy. Mental health needs also establish a level of foster care that the child should be placed in. In Wisconsin, foster care varies from level 1 to level 5. As foster parents get more trained and certified to take care of high needs kids, their level goes up. And finally, based on the mental health needs, foster parents are offered compensation for the financial cost of having children placed in their home. Higher the mental health needs, the higher the compensation is offered to them by the state. But this is where things start to get muddy. CANS is conducted every 6 months. The caseworker will interview the foster parents and ask them about any changes in the child's behavior, risks, and needs. The level of foster care is often ignored in subsequent assessments because you don't want to disrupt a placement unless things get worse. And then based on the mental health needs, the foster parent compensation is recalculated. But you might think that the cyclic process diagram is not quite accurate because it would mean that compensations are informing the mental health needs in the next cycle. And that is the muddy part. But a little bit of context first. There's a lack of good foster homes in the system. So the priority is always to ensure that a placement is financially supported and not disrupted. So let's discuss a good scenario where CAN is working supposedly the way it was intended. So foster parents put in a lot of work with children, help them slowly cope with trauma, provide them with structured life. But then the child's behavior stabilize and their mental health needs supposedly go down. Well, at least on the assessment. But now the compensation goes down as well. This is what a child welfare supervisor had to say about this. It is the complete opposite of what we want CANs to do. Foster parents help minimize the behaviors and offer support so kids can develop good coping skills. They help address the mental health needs and help kids stabilize by taking them to therapy and all their activities. But then they are punished because the kids' needs go down and so does the rate. Now let's touch upon a bad scenario. Well, both caseworkers and foster parents have figured out that the compensation is tied to mental health. So now the once removed outcome of interest has become the primary outcome, which is informing how mental health needs are scored. And this further decides which mental health services are offered. So caseworkers will continue to game CANs as new financial needs show up for the kids. And this is what a child welfare supervisor had to say. Case managers and even supervisors are being forced to and kind of pressured into scoring children higher in order to provide higher numbers. CANs is all about producing a good rate so foster parents can afford the resources they need to take care of the child to take care of the child. I have had foster parents put in notices to end placement because they couldn't support the child anymore. But there's another problem here. Most foster families are trying to help kids, but at the same time, there are also foster parents who take in 5 to 10 foster kids and are basically running this as a business. They would be getting paid about $1,200 a month for a child, and they would say things like, well, this is more like a $1,600 kid. A caseworker said to me that the CANS algorithm has created a bartering system for foster children where children are now being exploited for payment. Now let's talk about 7 essential ingredients. This algorithm is locally developed at the agency using best practices from trauma-informed care. It is used in a team setting with the staff involved at the front end of case planning. This is what the team looks like. The red people are the case management group. The blue people are the family preservation group. Then there are the permanency consultants, family and child liaisons, and then child welfare nurses and licensing specialists also involved in the middle. But back to 7EI. Child welfare staff may not have agency with respect to critical decisions, but they can still help families and prepare them receive a favorable outcome in court, and that is affecting the critical outcomes of interest. So the team breaks down every case into 7 domains. They discuss the domains and figure out how to make progress on each domain using principles from trauma-informed care. They score these domains through the life of a case, and so instead of predicting an outcome of interest, they're tracking each of these outcomes over time. It also allows them to quickly understand what are the core issues in a case. Is it the prevalence of trauma? Is it the emotional regulation of the child? Is it the caregiver capacity or the relationships that the child has? And so here are some lessons from our participatory design approach. As I mentioned, it is imperative to map out the power dynamics in the public sector domain and understand where the critical decision-making power sits. This also allows you to carve out the space and scope of participatory design. Number 2, PD without designers. The agency asked us to build a risk assessment algorithm, which we refused to do. We asked them to refocus on what they cared about. What did they think they needed to do to improve their practice? So they focused on trauma-informed care and came up with 7EI themselves. They understand this domain better. They know how workshops work. They don't need us for any of this. We purposely gave ourselves less agency in this process so we could come up with something that the workers actually cared about and were invested in, even if it's not technical in nature. Number 3, continuous engagement. So now we are helping them with what implementation looks like. Before COVID, I was at the agency all day Monday and Wednesday and attended meetings where 7EI is used. I reported back on the observations and what the implementation is looking like. Is there confusion about meaning of variables? Confusion about scoring? Are people actually finding value in it, or is it just adding more work? But the best part of 7EI has been that it's used in a team setting and it allows the team to freely brainstorm on how to make progress. It's not tied to a predictive outcome or a singular metric, so caseworkers don't feel pressure to score variables one way or the other. So finally, just a few key takeaways. It is imperative to understand the underlying power structures like mandated reporting, so we don't naively conceal them within algorithms, as well as the need to understand the value conflicts that exist in the domain. As we saw in the case of CANS, predictive algorithms can further problematize policies. The CANS was introduced as a means to consistently allocate resources, but as we see, it's actually a lot more problematic than that. If predictive algorithms try to limit the discretionary work on part of practitioners, they will find ways to bend the algorithm and game it to reclaim that agency. And as depicted by 7EI, practitioners preferred a structured framework to organize information, make decisions, and track outcomes over time instead of predicted outcomes. And that's all I have. Thank you.
So I'm going to say a little bit, and feel free to to the audience, feel free to type in any questions or anything like that. But as the organizer of the series, I get to take first question. But one of the reasons that I was so excited about both of your work is that you're thinking about the application of algorithmic systems in largely public contexts, in a space that really gets that finds itself in this sort of muddy area of public administration and governance in the conventional sense that we typically think of. Although I find myself thinking a lot about algorithmic systems as a sort of governance problem just on its own. But the question that I was thinking about, especially at the end of your talk, Devansh, is essentially about, I guess you could say, to what extent familiarity or expertise with the system, and certainly resources to become an expert in whatever the system is, mediates whatever that stakeholder would define as success. So in the case of parents having some knowledge about the lottery system for the education, for the school systems, it's being aware of kind of like any mechanisms that you might have to get whatever outcome that you're looking for, to get the school that you want to be assigned, or that you want your kid to be assigned to. And in the case of child welfare, it's knowing what factors play into the algorithmic system itself. And so I'm really curious, I guess if both of you could elaborate a little bit more about what the dynamics are of, I guess you could say, unequal access to resources and that sort of inequality, and how it factors and how it sort of like feeds into this, like the inequalities or any inequalities that you all perceived in how these systems run and operate.
I can jump in first. This is something we've been thinking about a lot. I think there's a lot of interest right now in algorithmic transparency, how to hold the people or institutions who are running these algorithms accountable, but also allow different stakeholders to understand how it works. And matching algorithms compared to machine learning algorithms, predictive algorithms, are really interesting because they follow a explicit and predefined procedure. You can kind of explain, supposedly, to parents how it works and why they got a particular assignment. But what we find in practice is that really only the highest resource parents that we spoke to had any interest in understanding how the system worked. And potentially the exception to that is community groups. I mentioned some of the nonprofits that have support families. So the Oakland Reach is one in Oakland who are doing really amazing work with families. And they have, a very deep understanding of how the system works and how they would like to see change to support the families that they work with better. But I think something that we've seen is kind of, we originally came into this project thinking, oh, information disparities are bad. But I think the more we spoke to lower resource families who are facing, a number of challenges other than finding their child a school. So often you're finding a school because you just moved house, or you just immigrated to the country, or you're experiencing housing insecurity. And in those circumstances, you have other concerns on your mind, and researching 72 elementary schools is not feasible, should not be expected. So thinking about who to target information to, and thinking about the importance of kind of these personalized relationships that I kind of tried to allude to at the end, but didn't touch on too much. I think we found that's been the most valuable thing for kind of lower resourced families that we've seen, is these personalized relationships, someone to sit down with them, answer their questions, provide support that's relevant. So not just, here's your giant list of 72 schools, really understanding their needs and providing relevant information.
So I can talk about in terms of caseworkers and information disparities of algorithms. So algorithmic power plays a very important role here. And the information disparities are huge because in child welfare, either you have caseworkers who have just been there for a year or two because their turnover is so high, or you have caseworkers who have been doing this for 10 plus years. So one of the cool things to observe at the agency was the seasoned caseworkers would actually first come up with a decision they want the algorithm to make, and then just reverse engineer the algorithm to produce that outcome. On the other hand, young caseworkers, well, new graduates, most of them, are terrified of making any poor decisions through these algorithms. at the same time, they have such high caseloads, questioning the algorithmic decision actually adds even more work on their plate. So they socially learn from other caseworkers how to effectively game cans to produce higher numbers. And so the cans takes in the child risk and child needs. So they'll pick out predictors that they can easily game without being caught. It's well established at the agency that people are gaming the algorithm. Most people consider that this is how the system is set up to be used. Gaming is just part of it. So they'll score anxiety and depression high, but at the other hand, things like delinquent behavior or fire setting or bullying, things that you need sort of evidence for, they won't touch. So they socially learn from other caseworkers on how to effectively game the algorithm.
That's really fascinating, and that sort of goes back to the earlier point that you were making about like the fabrication of data and like the fabrication of data, and then also like the embellishment of data by like conflating various kind of categories of things, and that all sort of seems to go into like I guess like a thing that I've been thinking a little bit about lately, which has been like the ambiguity of the world itself and how hard it is to like come up with a computationally satisfying like discrete answer for any question that somebody asks, like what is neglect, like what is sort of like an unsafe like home environment, to the question of like to the question of like assigning school like placements and things like that. You ask a question like, is this person in the same family? And like, I mean, family kinship is like a whole area of anthropological research, and like it's not clear cut necessarily all the time. And like I could imagine all sorts of ways that like all of these kinds of questions get really complicated really quickly, just because life is really complicated. And I could see like an entire sort of like landscape of work like sort of like unfurling on this subject. But I do want to let I guess the two of you ask any questions of each other if you have any thoughts, and also if the audience has any questions or anything like that, feel free to go ahead and put them in the Q&A or in the chat section.
I've got a question for Sam. So Sam, I feel like yours the things you're studying are so much more complicated, because in child welfare, at least I have like a physical space or a physical location where I can go observe meetings and do different things. But in case of student assignment, I feel like the stakeholders are all over the place. So how do you kind of reconcile that? Where, if that makes sense, like who do you go to talk about these things?
Yeah, that's a great question. And unfortunately, the majority of my work in this topic has happened in a pandemic. So even if there was a place that I could go sit, for example, a lot of both San Francisco and Oakland have education placement centers where parents can go and talk to somebody and learn about the different schools. So that would definitely be somewhere that if I could have, I would have sat, especially, parents just went through this process a couple of months ago. So it is too bad that is not somewhere that I could have been. At the same time, what we found is really helpful was actually building these relationships with people who are directly helping families. So people like working in nonprofits or working in the district who directly help families, and they were able to either introduce us to parents that they work with, because you're totally right. There are parents all over the district with very different experiences, and we wanted to try to reach a diverse sample of parents, which we found did not happen when we tried to recruit online. So that's been our approach. But
so in the student assignment centers, who's like the street level bureaucrat that you can like appeal the algorithmic decision to? Is there one?
Yeah. So the people who work in the assignment office are definitely, I think, the ones that people do tend to go to, and parents reported kind of mixed experiences there, whether they were listened to and their needs were heard, or whether they were kind of coerced into particular choices. And one person that we spoke to specifically works with refugee families, and he had a really interesting perspective because compared to someone at the Education Placement Center who has to serve any family who walks through the door, he serves like a very specific community of families who have, some element of shared experience. And so he's really learned over the years how to provide effective service. So yeah, I think that's the main way. Also schools, but people have all different theories about how they can, game the system to get their student in, and it's very unclear what actually works.
Sure.
I had it looks like there's a question in the chat. I have a question for you, but we can for an audience question first.
Let's have, I guess, one question from you, and then I'll go ahead and go to this question.
Sure. Devansh, I was interested, you mentioned that the folks you were working with originally asked you to build a predictive system, and you said, no, like you need to think about what you actually need. And I'm curious why you think they were drawn to the predictive algorithm to begin with.
So a lot of the funding and the RFPs in child welfare from private foundations and government are focusing on bringing predictive analytics. And the easiest way to do that right now in child welfare is to build a risk assessment algorithm. Because child welfare already uses a bunch of assessments for which they have collected data over almost 2 decades. And so it's easy for them to just turn it into an algorithm. So the CANS algorithm is an algorithmic version of a CANS psychometric assessment. And what has happened in child welfare is that a lot of these psychometric assessments have turned into algorithms, and people don't recognize that. So even during my interviews and observations, I had to nudge people to think about the more automated aspects to realize that they were actually making automated decisions, and they were not just the assessments that they were trained in school.
There is one question from the audience, and I'll go ahead and read it out. To what extent have each of you included educators and community leaders who engage with the children on a daily basis? It seems that many of these conclusions that while quantitative analysis can be helpful, it seems that extra work with these demographics could shed a lot of light on the issue that seems very qualitative.
That's a very good question. And when we started working on this project, our intention was to include more foster parents and foster children into these studies, but apparently for universities that requires a full IRB, and we have submitted like 6 revisions to this, and we still haven't, and there are still more revisions to be submitted for the full IRB process to be approved. So we haven't, but some of our collaborators are educators in social work, and our collaborators in the University of Central Florida, they have conducted studies with foster parents and foster children.
Yeah, I would also add that I think working with educators, working with even students would be amazing. We started with parents and then learned that kind of community leaders who work with parents are a really useful resource and offer a lot of context. So that's been really helpful for us. I would say, interestingly, like as much as IRB requirements feel like a kind of boring topic, like I have also run into challenges trying to do this work where the timelines of university work don't align with the timelines of community members. So trying to connect with, someone who's going to connect me to the mom speaking community in Oakland and needing to find an interpreter and then needing to get that interpreter through the IRB process before I could actually interview anyone. And by the time I get there, the momentum that we had built was kind of lost. So I think kind of practically speaking, that is a real challenge when you're trying to do this community engaged work, is like aligning kind of the academic incentives or the academic structures that we're in with the ways that this works on the ground. But that said, I would fully acknowledge that educators and other children even are a stakeholder group that I would love to engage in future work, and also shout out a group, Integrate NYC, who are based in New York, and they're a youth-led group who have been doing great work in the student assignment and integration space.
Yeah. Something that I find myself just realizing now is that in a number of places where people who study algorithmic systems and like the ways that they're felt on people, like a lot of the subject domains that we find ourselves interested in happen to be in the areas where IRBs are particularly worried about. So to make that more concrete, like a lot of AI ethics researchers are really worried about how algorithmic bail recommendation systems are used, but that implicates people who are in the prison system, which IRBs are understandably very worried about. Similarly, with medical healthcare patients, there are a lot of concerns about how AIs are being used in that context. Again, it raises a lot of concerns, again, justifiably. And then in this case, with both of you, it's with children. As soon as somebody mentions that they want to do research with children, that raises all of these concerns. But algorithmic systems are being used really readily in these contexts with that involve children. So it seems almost like to do academic research following on oftentimes like varyingly privately funded initiatives such as these. Like it's almost as though you're sort of like you have to like run at half speed to catch up, and it's like, okay, well, how could you possibly keep up with all of the developments that are going on? But that's a really great question. I'm glad that somebody asked that. Do either of you have any other questions or anything like that? I can think of like one or two that I have, but it's basically about sort of like the various pressures that both of the stakeholders, that stakeholders in both of your fields of study typically feel to, I don't want to say like come to a conclusion that may be counter to what the design of the algorithm implies, but essentially that, like in one case, it's kind of school administrators or teachers having their own sort of desires or wishes or motivations, like their own incentives to get certain outcomes. And then in the cases of case managers who are, I think, Devansh, you said like pressured into scoring certain ways. I'm just sort of curious if you two could unpack those, I guess you could say, competing pressures a little bit.
So just thinking about cans again. So one thing that's happening is the compensation is informing the mental health needs, but then through the mental health needs, there are also services that now the kids have to go to. So one thing that's happening is now foster kids are being sent to unnecessary services. So think about this: foster children who are already traumatized or have had something bad happen, or they're just away from their parents. Now they're continually being told that something is further wrong with them. And now, so that's a dilemma that caseworkers see themselves in, but at the same time, they understand that the child is better off in this foster home with a foster family than going to a group home. One thing that's happened in Milwaukee is that group homes for foster youth have become recruiting centers for sex trafficking. So caseworkers will do whatever they can to continue to make sure the placement is not disrupted and the child stays in that home, even if that means sending them to unnecessary services.
I was I'm kind of reflecting on this question, given, preface this with the fact that we haven't been talking to educators. But I think what kind of came up for me thinking about this idea in the student assignment setting is that I think there is a way in which, and I am guilty of this coming from a computer science background and being brought into this because of my interest in the way people interact with algorithms, but I think there is a way in which once an algorithm gets involved, people get sucked into thinking about the algorithm when that might be far from the most important issue that people are facing. So a lot of parents that we spoke to, when we talked to them about enrollment and finding schools, what they really wanted to talk about was the challenges they faced once they were in a school and how they felt that, multiple parents we spoke to felt that their child ended up in a classroom with a teacher who was racist, and they needed to move them out of that classroom. And when they went and talked to the principal, they weren't receiving an adequate response. And they ended up having to go through the choice process all over again. And these are things that don't initially seem like algorithmic problems, but that are very relevant to parents. And so I think when it comes to educators, I would guess, and this is like without much knowledge, but would guess that, again, it's kind of this question of, I'm facing resource constraints in my classroom, or I'm trying to teach students who don't have stable housing, and it's hard and I need resources, and why are we still talking about this algorithm? So I think that's something to keep in mind, and it's something I try to keep in mind as someone who's coming to this from an algorithmic background.
That's great. I realize we're just at half past, so I don't want to take over anybody's afternoon. But I want to thank both of you so much again for coming. Once again, everybody, Devansh, Saxena, and Sam Robertson, give a virtual round of applause to the two speakers. Thank you all so much. So everybody, thank you all for attending this speaker series. We will be back. I forgot when we'll be back, but we'll be back soon with another speaker. And thanks again for attending. I'll see you next time.
Thank you so much, Ellen.
Thank you. Bye.